Hello everyone, welcome to Gray Matter, your soon-to-be one-stop shop for all your exam preparation needs. Today, we're going to talk about the PLAB and the UKMLA. Now, both these exams are licensing exams, and you of course need a license to practice in the UK. And these exams will get you that license. Now, if both of these are a similar exam or are for licensing, what's the difference? The difference is that the PLAB has always exclusively been for IMGs or foreign medical graduates. So if you graduated from a medical school outside of the UK, you would have to pass the PLAB exams to get a license. The UKMLA was introduced by the GMC for local graduates, okay? And local graduates, so graduates who have attended medical school in the UK, would have to pass the UKMLA exams to get a license. The GMC will replace the PLAB with the UKMLA eventually, which means it will be for foreign graduates as well. So there will be one standardized exam for local and foreign graduates to get their license. This replacement of the PLAB will happen in 2025. At least this is what we predict. Only the GMC knows when this is going to happen, and they will announce this big change well before it happens, okay? So they'll definitely give everyone a heads up. But in the year 2024, it's all about the PLAB for foreign medical graduates. They will not be sitting for the UKMLA. Now the PLAB has two parts, the PLAB 1 and the PLAB 2. The UKMLA has two parts as well, the AKT and the CPSA. Now, we have quite a lot of acronyms going on here, so let's just run through them. The PLAB stands for the Professional Linguistics Assessment Board. The UKMLA stands for the United Kingdom Medical Licensing Assessment. The AKT stands for the Applied Knowledge Test, and the CPSA stands for the Clinical and Professional Skills Assessment. Now, the PLAB 1 and the AKT are very similar exams. They are multiple choice question-based exams. They'll give you a clinical vignette or a clinical scenario. They'll ask you a question about it, and then they'll give you 5 options, and you'll have to choose the best option. The difference is the PLAB 1 has always been on paper. The AKT will be on a computer. The PLAB 2 and the CPSA are OSCE exams, or objectively structured clinical exams. So you have to fly to the UK for this, or you have to be in the UK for this, because the examiner needs to see you in action. They need to see you work as a doctor. So they'll give you a simulated patient or a mannequin or a prescription pad or something, and they'll be assessing some kind of clinical skill or professional skill of yours, okay? So they need to see you in action. Now, the PLAB exams have always been created using the PLAB blueprint. The MLA exams will be created using the MLA content map. Okay? Now, what are these exactly? What's the PLAB blueprint and what's the MLA content map? These are files created by the GMC, and you can go and Google them and see them on the GMC website. And these basically have guidelines or the syllabus or the curriculum for these exams. Now, why is this important? The examiners need to know what they will be testing you on, okay? And you need to know what you will be tested on, okay? So that's what these files contain. And they draw from a bunch of different other places: the foundation year curriculum, graduate outcomes, GMC good medical practice, a lot of different things, okay? But the important thing to know here is the GMC sent out an email to everyone who had a PLAB 1 or PLAB 2 booked, saying that anyone who sits the exam after the 17th of May 2024 needs to keep in mind that they will no longer use the PLAB blueprint for the PLAB 1 and PLAB 2. They will be creating the exam using the MLA content map. Now, what does that mean for you as an IMG? That means you will see new scenarios, okay, newer scenarios or new scenarios and new stations, okay, new questions, and they'll be assessing you in a different way, okay? They might be looking out for different things, and they'll just use the MLA content map as their guide, okay? Now, one thing I do want you to know is that the overall structure of the exam and the format of the exam for PLAB 1 and PLAB 2 will remain the same, okay? So the time duration is going to stay the same, the number of stations, the number of questions, that's going to stay the same, the total marks are going to stay the same. It's just that you will see new things, new scenarios, new questions, and they'll be checking you or assessing you in a bit of a different way by using those new questions and scenarios, okay? But don't worry too much, because the GMC did say in this very email that the PLAB candidates will not see too much of a difference in the PLAB, okay? Now, one other thing I want to talk about is recalls. Recalls are illegal, so you shouldn't be relying on them in the first place, but if you do use them, don't rely on them completely, because now you're going to get new material for your exam, okay? So the best thing is to hone your skills and increase your knowledge, okay? So that whatever exam pops up, whether it's the UKMLA or the PLAB, you'll be fine, okay? So making sure you have your core concepts and making sure you have your core skills will make sure that you'll pass your exam, okay? And we at Gray Matter will have a course coming out, and we'll have videos after this one to teach you all of this, okay? Because it doesn't matter if it's the UKMLA, if it's the PLAB, if it's some kind of other exam, the way you conduct a consultation is going to be the same, the way you break bad news to a patient is going to be the same, the way you handle an emergency scenario is going to be the same, right? All those core skills and all that knowledge stays consistent across all these exams, okay? So thanks for watching. Thought I'd get all this important info out to y'all. Please subscribe, like, and share. See you next time.